And when I do spring tests here, I cannot create any motion on the left in terms of anterior rotation. On the right, I can load it. I can see his legs moving because the force goes through it. I can spring and induce motion. In terms of inferior glide, nothing. It's like a bucket of concrete. On this side, take up the slack, spring, spring, spring. Okay? On the sacrum, I'm at S1, 2, 3. I can take up the slack. I can spring through that joint. Okay? Very little motion is happening in the SI joint, but it's translating the movement. Okay? On the left side of his sacrum, nothing. I cannot induce any motion there. In terms of a superior spring on his ischial tuberosity, I take up the slack, and I'm probably putting 30 pounds of force here, and I can spring him and I can make the whole body move because the movement translates through that structure on up. On the left side, I'm pushing with a whole lot of force. I'm pushing with both hands, and we're just not creating any kind of motion.
There's more black chairs.
Curious about the ligament here. We just finished teaching a workshop, so there's a little bit of noise, and I'm tired and not too smart right now. But this ligament, just out of curiosity, still feels like a ligament. Okay? Can we have you lie on your back, please? Now, I'm going to test lateral side glide of the pelvis, and I can take up the slack a little bit, and I can create a little bit of mobility, but it's certainly less than I would expect. For if your SI was not fused, I think you would have a lot more mobility. What's very interesting is that on the left side, there's no mobility. Now your hip joint is fine, right? I mean, your hip motion is beautiful. So this gives us a very interesting demonstration. Your lumbar spine is not fused, it's not sclerosed. So this gives us a real indication of how important or how relevant motion in the SI is to functional movement in the pelvis, okay? I cannot create any movement going from the left to the right. Nothing. Nothing. I'm saying on 1 foot. I cannot translate that. Okay? I'm going to do a posterior rotation spring test. And it's probably just a really, really minute movement in the SI, at which point the joint compresses but then translates forces and movement. Take up the slack, spring, recoil, spring, recoil, spring, recoil, and a final recoil when I let go. On this side, just nothing whatsoever, nothing at all. And if you put on your stomach, we'll show the L5 segment has mobility. So this is L4-5 because it's the top of the iliac shelf. Or you could isolate the PSIS, which would be at S2. That makes this S1, and that makes this L5. So both methods took me to the same place. Take up the slack a little bit, and there is a little bit of give. It does feel like it's reduced motion. It's reduced somewhat, and now I'm on 4, but not too different from 4. Okay, so maybe that is normative. But I think it's just fascinating that the left SI is fused and it really blocks that side glide motion. And I think we're done now. Thank you so much.